Before we get into menopause itself, let's first talk about that transition from normal regular menstrual cycles to the perimenopausal phase. That precedes menopause, and it has some very specific symptoms associated with it. The first one that most women notice is that their menstrual cycles become more irregular. They may skip cycles, they may go a month or two without a cycle and then have another cycle that's heavier than is usual. It may last longer, it may be much more painful. That's one of the early signs of perimenopause. There are additional signs though. You notice that you feel warmer. Your body temperature goes up as a result of these changes in your hormones. You don't usually get to the point of having frank hot flashes that is associated with menopause, but you're moving in that direction. Other symptoms that can be occurring is changes in your sleep pattern. You find it more difficult to go to sleep and to stay asleep. You feel less comfortable. You're less relaxed. You become more anxious. In some women, they actually develop anxiety disorders or are diagnosed with anxiety disorders that truly are really just perimenopause and get put on inappropriate medications for anxiety that are not necessarily even called for. You can have difficulty with painful urination. You can have problems with painful intercourse. Sometimes just sitting can become painful as a result of the change in the secretions in the vaginal mucosa. You can have difficulty with respect to your frequent urination. That also can be a sign of perimenopause. And then even memory impairment. And this is a real important one. You notice that what used to be a very sharp mind or very sharp memory, you develop this foggy thinking and difficulty remembering things that used to be very almost instantaneous when you were a little bit younger and your hormones were in a different position. Many women start thinking that they're losing their mind when this happens or that they're developing early Alzheimer's disease. And all it really is a change in your hormones. What happens if we don't do something about this early on when these symptoms develop? Another symptom that can occur is palpitations. You can develop racing heartbeats, skipping heartbeats that can wake you up in the middle of the night. And many women show up in the emergency department thinking they're having a heart attack or going into atrial fibrillation, when it really is just a tachyarrhythmia associated with the imbalance of the hormone milieu. What happens if you don't fix this? Well, again, a lot of times women become misdiagnosed. They end up in cardiologist's office. They're put on beta blocker therapy. The beta blocker therapy designed to slow down your heart rate, increases the amount of fatigue that you're already feeling, and actually exacerbates some of the other symptoms that you've already been suffering from. One of the symptoms of perimenopause that we touched on just a minute ago is the foggy thinking and impairment of memory. This is a very important symptom, and it's also very important that we pay close attention to it. They've done some studies, brain imaging studies, that show that if this is unaddressed, if you don't start to correct that imbalance of the hormones early on during that perimenopausal phase, there can actually be long-term neurologic consequences, an increased risk of depressive disorders also, an increased risk of dementia that can occur in women just as a result of them not getting the proper treatment during the perimenopausal phase of their life. That's a high price to pay based upon old science that has since been corrected. The problem is, as much publicity and attention that the Women's Health Initiative got, the follow-up study did not get one fraction of that attention. Myself, I did not even know that there was additional data that basically took those findings of the Women's Health Initiative and reversed them until very recently. And I think that's true for the majority of the medical community. It's something that has to be changed because we're causing women to have unnecessary suffering, but also long-term effects that can be irreversible. If we would just pay attention to the early signs, listen to your patients, listen to the women who are coming in with these complaints and not write it off as something that's related necessarily to their psychological status and or even their cardiovascular status as we described earlier. Because we make the wrong diagnosis, we initiate the wrong treatment, we don't get the proper results, and we risk long-term complications. We've got to pay attention. But you as patients, you women, you need to pay attention and be your own advocate. When you start having these symptoms, now that you have a definition and you can identify these symptoms, go to your doctor and be your own advocate. Let them know that you think this is related to your hormones. Encourage them to do hormone testing. And based upon those hormone tests, initiate appropriate hormone replacement therapy to help ameliorate the symptoms and eliminate the potential long-term consequences. All right, there's some key elements that we need to talk about in women who have gone through the perimenopause and they're now in menopause, things that they can do outside of hormone replacement therapy if they're not already on that, or if they've used it and they're still symptomatic to some degree. And that includes your diet. There are certain things that you should focus on if you're still having menopausal symptoms that can help ameliorate some of those symptoms just by changing your diet. You need to be sure that you're focusing on nutrient-rich foods. That means plenty of fresh vegetables, whole grains, lean protein sources, seafood, poultry, beans. Those are all very healthy forms of protein that can be very beneficial. Also, you want to limit the processed foods. Processed foods are usually high in fat, high in sodium. All of those work against your goals once you go through menopause, because one of the symptoms of menopause is excessive weight gain. So you want to try and eat a healthy, well-balanced diet that is full of protein-rich, low-fat, low-sodium containing foods to help decrease the risk of that excessive weight gain, which puts you at risk for other medical problems like diabetes. Also, to help manage your hot flashes, there are certain foods you should probably be avoiding. Spicy foods can increase hot flashes. Alcohol definitely can increase your risk of hot flashes. If that's one of your problems, you certainly don't want to add to the problem by eating foods that can make your symptoms worse. You want to make sure you're getting foods that are very rich in calcium as well, particularly fatty fishes like salmon. Salmon is rich in omega-3 fatty acids, and it also is very rich in calcium. And that helps with the potential bone loss that can occur in menopause and postmenopausal states. Also, I recommend everybody, but particularly women who are in the perimenopausal and menopausal phase, be sure that they're on a good multivitamin supplement, one that provides them with 100% of the recommended daily allowance of most of the vitamins and minerals, calcium being among those, to be sure that we try and decrease the risk that your diet is not adequate in those very important substances that help your body to function normally. Cellular function is thrown off when those hormones are thrown off. And as a result, you got to do everything that you can within your power to try and restore that normal balance so that your body works as efficiently as possible and decrease the risk of side effects from the menopausal state. If you haven't subscribed yet, hit that subscribe button. If you like the content, hit the like button. And also, don't forget about that bell notification. I'd love to hear your input. I want to get your interaction because it helps us in terms of content creators, knowing what topics you want to focus on and perhaps topics we hadn't thought of that you'd like to see discussed. God bless you.